Hi friends, today we are going to discuss about the mechanism of action of digoxin. Digoxin is a drug which act on your heart muscle cells and increase their contraction. So let's begin and let's go through the action of digoxin. For this purpose, I made a diagram of your cardiomyocyte and all the channels present on the surface of cell. So this is cardiomyocyte. It has the sarcoplasmic reticulum. There is sarcoplasmic reticulum. The function of sarcoplasmic reticulum is that it store calcium ions. So this about the cell, and it has different type of receptors and channels. This I made here is sodium potassium pump, and here is that sodium calcium exchanger, and here is there is the L type calcium channels. Here the ATPase, calcium ATPase, and here the ryanodine receptors. So this is L type calcium channel. This is what we call as sodium calcium exchanger, and this is what we call as sodium is potassium pump. And here we have the ryanodine receptor, and here we have the calcium ATPase. So when the action potential from the neuron reach to the muscle cell, and this will causes the depolarization of the muscle cell, and finally it's cause the entry of calcium inside the cell. The calcium enter into the cell with the help of L-type calcium channels and T-type calcium channels. So L mean long-lasting calcium channels. When calcium enter inside the cell, some of the calcium will cause the muscle contraction, and some of the calcium will attach to the ryanodine receptor and activate the release of calcium from the sarcoplasmic reticulum. So calcium from outside and calcium from the sarcoplasmic reticulum automatically increases the cause the muscle contraction. So here we can see that the calcium is very responsible for muscular contraction. Calcium from the outside through L-type channels and from the sarcoplasmic reticulum with the help of ryanodine receptor and certain type of T channels, it's come outside, and this calcium causes the contraction of the muscle. And after depolarization or after the function of contraction, the cell again will come its normal position, and when it come to its normal position or normal state, in this condition the calcium which enter inside the cell, they will start move outside the cell. They will start go outside, and some of the calcium will again enter into the sarcoplasmic reticulum with the help of calcium ATPases. So here the function of the sodium calcium exchanger is that it remove or the extra amount of calcium from inside the cell to the outside. And the function of the calcium potassium pump, we know that it will after depolarization to maintain the normal resting membrane potential, it will release 3 sodium out and 2 potassium inside the cell. So if we give the digoxin drug to such a patient whose heart muscles not work so effectively, so here the digoxin comes in attach with the sodium potassium pump and stop the functioning of the sodium potassium pump. It will inhibit, so it is non-competitive drug. It will inhibit, as it inhibit the entry of calcium sodium out and potassium in, so more and more sodium starts to accumulate inside the cell. So we can see that more and more sodium will accumulate inside the cell, start accumulating inside the cell. In a normal condition, the sodium calcium exchanger bringing sodium 3 sodium in and 1 calcium out of the cell, but after the action of digoxin, due to the accumulation of more and more sodium ion inside the cell, the sodium calcium exchanger will reverse its function. That now what it do, it will take 3 sodium out, 3 sodium out and 1 calcium into the cell. So calcium increases inside the cell, and this sodium will go outside and calcium starts accumulating inside. So here we can see that the digoxin will act on the sodium potassium pump. It inhibits the function of sodium potassium pump. As a result of this, the more and more sodium ions starts to accumulate inside, and due to this accumulation of sodium inside, or the increasing in the concentration of the sodium inside, the sodium calcium exchanger will reverse its function and it will bring calcium from outside to inside the cell, and it will release or remove 3 sodiums out and bring 1 calcium into the cell. So as more and more calcium accumulate or enter inside the cell, some of it enter into the sarcoplasmic reticulum and they stored here for the muscle contraction, and rest of the calciums will increase the contractibility of the heart. So we can see that here the calcium ions inside the cell increase. Due to this, the contraction of cardiomyocytes will increases. So this is the action of digoxin, that it increases the muscle contraction. So thanks for watching.